So that's a lot about what we're going to talk about today as well, but we're going to all frame it around your balance and what we can do to help you stay as strong in your balance as possible so that we're not having falls. Has anyone had a fall? Would you mind raising your hand? Thank you. Some over here too, right? Well, I'm glad you're here. Thank you. There are about 1 in 3 adults a year falling. Okay, so if we just count it off, every 3, one of these people will fall each year. So that's why we feel it's so important that we are working to educate people on what they can do that's to prevent those falls. Because of nearly 30% of those falls result in something serious, like a hip fracture, a wrist fracture, hopefully not, but possibly a head injury if you struck your head. So all of those things can definitely change your life as you know it immediately and may never return to that state of independence that maybe you have today. So it's more preventing that actual fall from happening than ever rolling the dice and wondering if you'll get back to that spot that you were before the fall. So that's why I'm here today. I always like to speak in September because it's a National Awareness Month for Fall Prevention. And Cleveland Clinic, along with a coalition here in Nevada called the Nevada Goes Falls Free Coalition, and the National Council on Aging, we like to do a lot of education and screenings within this month just to let people know if they are at fall risk and what they can possibly do to prevent being at a fall risk. Okay? I think we covered all of that. This is when we are going to, not only am I talking today, but in 2 weeks, like Susan said, we are sponsoring a fall risk screening right here, right next door in the events center. Okay, all right. So I'll move back here.
Thank you.
Absolutely. Then I can't see you guys, but I'm thinking about you over there. All right? So if you're interested or you know anyone that you feel could possibly benefit from being screened by one of the physical therapists or our new occupational therapists, then I'd like you to let them know about this. They can register on our website at keepmemoryalive.org, and the fall screening is where you would go in to register for that. Last year we did the screening. We screened 50 people, and 90% of our community who came was at fall risk. What we were able to do with those people is not only educate them, but also got them enrolled in a course that we held here every Saturday for 7 weeks called Stepping On. And it's a 7-week course going to educate you on different ways, more intensely, of preventing falls and managing your risk. So what can you do today to prevent falls? There's really 4 main things. And did anyone does anyone read the paper? I know you guys, a lot of you do. So on September 8th, which was Monday, right? Did anyone read the article in the paper about fall? Let me just tell you the title. Maybe you can go back. Slips and Stumbles to Help Seniors Stay Steady. It was a great article about some researcher that is working in University of Chicago. And he is working on creating a treadmill that actually makes you work on catching your balance, like tripping. It trips you. The treadmill trips you, so you can learn how to catch your step. So it's many years in process. That's what we do upstairs in physical therapy in some ways. But it's a great new article about what they're trying to do to help us know what the best way is to train our bodies so that we don't, even though we start losing that balance, how we can regain it. At the end of the article, I thought that the great topics here, what these highlighted bullets were some steps older people can take to reduce their falling. And they'll coincide here and maybe even add a few more. See what you think about my list. Exercise, including walking and stretching to improve muscular strength and balance. Have a doctor review all your medications for side effects, dosage, or drug interactions that could cause dizziness or drowsiness. Get yearly vision exams to make sure eyes are healthy and glasses are proper strength. Does everybody do that? It's so important. It's just one visit a year. But it is very important that you can see where you're walking, okay? Reduce risk at home, including decreasing your clutter, having better lighting. Poor lighting, it's along the same thing. You've got to be able to see to know where to step. Install handrails in the tub and showers. Limit your intake of alcohol, which can affect your balance. Stand up slowly. Everyone stand up too quick and get dizzy? That can happen, okay? Especially as we get dehydrated in the summer months, or maybe you're starting to take a new medication. You want to make sure you stand up slowly. And usually if you get dizzy when you stand up, it subsides if you take a couple seconds before charging off to what you're about to do. And then use a cane or a walker if needed for steadiness. So it gives a few more topics than I put on my list, but I hit it pretty good, right? We need to exercise. You need to have your health provider reviewing your medications. Don't forget, especially after a hospital visit, that is most important that you go back to that doctor that knows you and make sure that all of the medications that you've been given, someone's making sure that everything is going to work together well, okay? Having your vision checked yearly, as well as making sure your home is the best atmosphere it can be. So making sure pathways are clear. You've heard this before. We don't want rugs that can slip under your feet, right? You don't want extension cords or cords for lamps running across your walkway, okay? And then making sure this, especially the pathway from the bedroom to the bathroom is lit at night, and as well throughout the house during the day, that you can see where you're taking your steps, okay? Just implementing those things can reduce your risk of falling. Just that. But let's talk a little bit more about beginning that regular exercise program, because that's what we're here today to talk about, right? Is some exercises you can do at home that'll improve your balance. The CDC is a great resource. It stands for the Center for Disease Control. You okay? And what they do is work to make sure we have the information and the knowledge that makes us most safe. And they have done some physical activity guidelines for adults. And I thought they'd be important to review. Number one is avoiding inactivity, okay? If you like to stay in your house all day, and probably the most activity you get is using the restroom or getting the lunch from the refrigerator and then sitting back down, your body is not getting the exercise it needs to stay strong. On those days, you will lose strength. Okay? Inactivity is not a natural state for us. It's not where our body thrives. Adults should do at least 150 minutes a week of moderate intensity exercise. That means you can still talk, but you should feel a difference in your breath. Right? It should be a little more difficult. You should feel your heart rate rise. But it doesn't mean you have to be out of breath. Okay? The aerobic activity, because we're going to talk, you should be doing all different types of activity. Aerobic activity where you're walking, you're keeping your heart rate up for a duration, as well as strength training while you're trying to use some resistance or some bands or some weights and some balance as we talk about. But the aerobic training is sometimes hard for people, especially people that haven't done exercise for a while. And what we have learned through research is you need to do at least 10 minutes at a time. If you can keep your heart rate up for 10 minutes at a time, you are strengthening your heart, your cardiovascular system, as well as your muscles. You're getting benefit from that exercise. If you don't raise your heart rate and you only do it maybe 5 minutes, you may mentally check it off in your mind, that's 5 minutes towards my goal, but it probably hasn't given you the benefits it should. Okay? And then strength training. It involves all the muscle groups, and you should do it a couple times a week. We'll talk a little bit about types of exercises, but let's talk about that moderate intensity. I said that you should be able to talk while you're walking, right? That's about a medium level of effort. We kind of talk about it as a 5 or a 6 on this scale. If you can see this scale where it says 0 is rest. If you're sitting right now, all of you are, your perceived exertion scale is 0. All right? So if you start moving, maybe you just get up and go to the bathroom. That's probably pretty easy. Maybe it's not. Maybe it's about moderate. But when you're exercising, we want you to feel like it's hard. Not really hard, but hard. Like you're doing something. You're making your body work. And when you make it work, it responds positively by making you stronger. Okay? So it should produce a noticeable increase in your breath rate and in your heart rate, hopefully. Unless there's some medications that you are taking that can change that and not necessarily allow your heart rate to come up. Just talking about examples of exercises. For aerobic, we're talking walking, jogging, dancing, swimming, or bicycles. Even those stationary bicycles that have the nice back and you can lean up against, you're going to raise your heart rate with those, and that's a good thing. Or maybe you don't like those structured type exercise. You'd like to be out in your garden. That's something. Definitely raking or pushing a lawnmower. That gets your heart rate up. Aerobic exercise classes. There's some all over town in the community exercise programs, the community parks and rec, or possibly within the community you live. Tennis. Golf, you have to say without a cart. Okay, that golf isn't much aerobic exercise if you're using the cart. But muscle strengthening can be a variety of things other than just using the resistance bands or actually dumbbells and weights. Climbing stairs, that's a good workout for those legs. Okay, if you can do push-ups, pull-ups, sit-ups, anything you might remember from doing it in the good old days, those are strengthening exercises. Gardening a little differently, like digging or lifting or carrying something. Now that's giving your muscles a good workout as far as the strength goes. So gardening can overall, if you're doing it for a while, can be a good exercise for you. Just carrying the groceries in. Oftentimes, a gallon of milk is quite heavy. It can be up to 10 pounds, I believe. That's a good walk, from the car in. Maybe you have to go back and forth a few times and do a few arm curls before you put it in the refrigerator. All right? Some yoga or Tai Chi. There's so many different opportunities out there for strength training or activity that's just good to actually just get out and try them. That's the hardest part, though, right? It's just the hardest part. Sometimes, the best thing is just to get the person next to you to go with you. Okay? Because you got to remember, 1 out of 3 people in this room will fall this year. Okay? This is what we need to do to stay away from that. More guidelines. Now they say, because this is older adults, we know that there's things that have gone on. Your experiences in life may limit you in different ways. You might not be able to go out and run a couple miles like I can right now. That might change for me tomorrow. But if it's changed for you, you just need to know that and know that that's not within your ability and find something that is. Because I can tell you, there's something that everyone can do that can raise their heart rate, that wouldn't cause extraordinary pain and would make their system, their body stronger and better able to handle the circumstances that come up in front of them so that they can stay safe and right where they're at. Because that's what's important. We don't want anyone to move from their house, lose any independence, change their lifestyle at all. Anyway, in the bad for sure, and he is. And we just need to understand, if you don't understand how your conditions affect your physical ability, well, then that's why physical therapists are out there. And I know that your doctor, with your impetus saying, I want to exercise, but I'm not exactly sure what the best ways are, I bet there's no doctor out there that wouldn't let you come get some advice from a physical therapist and let us help you get an exercise program put together. Because that's what we do. For any age, for any person with any condition, that's why we go to school, is to understand what's best for your bodies and how we can help you all get stronger and stay up straight, standing, walking, doing the things you want to do. So we are going to do at our screening a couple tests. They're really simple, but I just want to let you know about them. The Timed Up and Go test. It's been researched for years and years now. And it's really simple. Some of you may have already done it. But someone might ask you to stand up from that chair you're sitting in right now, walk 10 feet in front of you, turn around, come back and sit down. Do you know that's the hardest test I need to give to be able to tell you if you're at fall risk? Look what it has to do. Your legs have to be strong enough to get up from this chair. You have to be able to walk 10 feet, then turn around. That's the tricky part. The turning around is hard, and it causes a lot of people to be dizzy and off balance. Turning around, then getting back to the chair. You have to turn around again to sit down safely. All of these things we do multiple times a day, and we need to know that you can do it safely without any difficulty in less than, 14 seconds. Turn my sign around. We also, or if you, I'm sorry, my sign's right. If you do it, if it takes you longer than 14 seconds, then I know we've got some work to do. Just standing up and sitting down from a chair uses so much strength in your legs that I'm really easily able to tell how well your muscles can tolerate your activities during the day. And we'd like to see that everyone is able to stand up and sit down of their own free will without using their hands 12 times. That's what we should be able to do. Okay? And I'm not excluding anyone. No age gets a pass from this here, from any of these. Okay? And then the 4-stage balance test is just trying to see, can you stand with your feet together? Can you stand with them kind of apart but pretty close together? How about one leg? So challenging and just looking at different ways of looking at your balance. So the reason why you're all here, right? 5 exercises to help your balance. Now, of course, I can't give you a lot of crazy, strange exercises that would be, one, difficult to explain, complicated to do, or unsafe to do at home, because you're going to take this information home, and I hope you give it a try. But what these are 5 simple exercises that if you just incorporate into your day, could definitely change your balance for the better. Backwards walking. Backwards walking is something that not a lot of people think about doing anymore. They just assume that they can do it until they try, and whoa, when did I stop being able to walk backwards? Well, you can't use your eyes to see where you're going, which is one large source of your balance. Our body uses our eyes for our balance primary, number 1. That's what we use. Number 2, we use the muscles and the sensation in our ankles. And number 3, we use our hips and our strategies to be able to recover a fall. Okay, those are our 3 ways we use it. And then another system we have in our head is called the vestibular system. Crazy name for our balance center within our body. But we know that if you don't see well, okay, to recap, we know if you don't see well, or if you can't see where you're walking, your balance is not going to be as good. And oftentimes we stop doing backward walking just because we don't need to. Okay, we're kids on the playground. Sure, we're dodging kids, we're walking backwards, we're doing different things. Maybe working created that situation where we had to walk backwards and get something out of the back seat, and we're moving all around with our kids. But as we age, sometimes we limit what we do just because we don't have to do it, so we don't practice it. Backwards walking actually happens in the kitchen and in the bathroom more than you realize. But without keeping that system sharp and being able to do it, sometimes can catch you for a loop. So just walking backwards. Good way to start that is walk along your counter, like in the bathroom or in your kitchen, somewhere you can hold on to something and just start walking backwards. Make sure you can do it. You can do it when holding on to a surface. Then I want you to let go, okay? Because you're really not working your balance until you let go. So then let go and walk along the surface. If that's still easy, pat yourself on the back. That's a good news, okay? But if you want to challenge yourself a little bit, then try to close your eyes and walk back those 10 steps. Probably should have your hands still by that counter if you're not doing regular exercise and this is something new for you. But just have your hand right above that counter and give it a try, walking backwards a few steps. If that's still really easy and I haven't stumped you yet, then you can try to put one foot right in line with the other when you step backwards. That will narrow your base of support and make your body work a little bit harder to hold on to that balance. Okay, so simple, backwards walking. That's number one, okay? Number two is sideways walking. Okay, this helps you negotiate around chairs, get through the aisles here when you're seeing a show or coming here to this conversation. We use the sideways walking all the time, but it also strengthens the muscles of our hips. Okay, so it's a really good exercise to make sure we're doing. And these exercises, if you think about it, if you're just cooking or you're in the bathroom, you can probably just knock these out pretty quick. Just check, I've made sure I've walked backwards today, I've done some sidestepping both ways, and then we'll get into the others. Sideways walking, normally I like to demonstrate, but I'm going to stand right here. Just holding, put your hands on your hips and just try to take some side steps right along the counter again so you're safe, but you're just trying to keep your toes faced forward and step sideways, okay? If that's super easy, then what we do is take the eyes away again. Close those eyes, okay? And do the same thing. Maybe 10 steps one way and then 10 steps the other, that's it. Okay? Now, if you've been to physical therapy or you have one of these resistance bands that we often give out, you can, if those are still pretty easy for you, you might want to just, if your balance is pretty good, oftentimes as an exercise, what we give to strengthen these hip muscles on the sides is we tie a band in a loop and we put it around their ankles. Then you have to sidestep. So that's working these muscles that stabilize us when we're standing. That makes them work a little bit harder. Okay? Pretty simple so far, right? Now here comes the little tricky parts. So heel walking. Heel walking is important. Have you ever heard someone say, heel toe, heel toe, heel toe? Well, what we're doing is strengthening those ankle muscles. Okay, those ankle muscles, I think I mentioned a little bit earlier today, are helpful to us when we lose our balance. They come into play there. They come into play every step. And so if we can continue to make sure we're strong with pulling our toes up and then walking on our heels a couple steps, our ankles are in good shape, okay? Again, this can be kind of tricky if you haven't done exercise or that you know your balance is a little bit weak. Hold on to something at the beginning, right? Then once you get it, then you let go. Then if that's really easy, again, you can probably see a pattern. Close your eyes, okay? But rather than tie something on your legs, what we'd ask is maybe you try carpet or something that's not so hard for your further challenge. Because a soft surface like grass, carpet, rocks, mats, anything that isn't just this nice solid floor is a little harder to walk on, right? All right, so we've got two sides to our ankle. We've got to work both sides. Coming up on our toes is also a good exercise for us. Strengthens those balance muscles. Okay, so just walking on your tiptoes, 10 steps. Again, hold on to something. I didn't put the eyes closed, but you can always do that. Or keep your eyes open or closed on that more squishy of a surface. Okay, even like a blanket you could put in if you were trying to really challenge you. But my guess is just not holding on and doing these exercises with your eyes open is a good place to be. Okay? The last one. We're already number 5. Stand up from your chair without your arms. Can everybody do that? Some people have difficulty with it, right? If you have difficulty, start with using both your hands just like you need to get up. But we're trying to get away from using our arms because that makes our leg muscles work. Oftentimes in physical therapy, when we're trying to build up someone's leg muscles, we might need to try from a higher chair first, We need to give the body a little better advantage to making those muscles be able to fire and accomplish the task. But soon, once we get them stronger at that higher surface, then we can start to drop it down and get those muscles the strength they need to get from any chair that you'll find in the community up and down easily. The best thing I could hope for all of you is that you don't have to think about how you're going to walk into a place, where you're going to sit when you get there, worry about what kind of chairs might be, or chairs on the way to take a break, right? We would like all of these things not to be concerns to you. And these exercises are working towards helping you with that goal. So if you can do it with 2 hands, but you can't do it without a hand, try just using 1 hand. Always try. Nice little tip is to scoot to the edge of the chair. Okay, the edge of the chair is always a lot easier to get up from than when you're way back into the chair. And then if you can stand up, no problem, without your hands, what I want you to try to do is a couple times a day, I want you to challenge yourself to go down slowly. Maybe you count a whole 5 seconds. Okay, so you stand upright, and then you're like 1, 2, 3, 4, 5. Okay, just making those muscles work. If we can make the muscles work, then they'll get stronger. They know how to get stronger. We just have to give them the reason to get stronger. Okay? Here's the bonus challenge. It's not something that everyone can do. So I've heard a million people tell me before that they've never been able to stand on 1 foot their entire life. That may be true. But if you can, you have really good balance. So try it. Try just holding on to something, bringing 1 foot up, and just try to let go for a second. Maybe it doesn't work. But you know what? Those side step exercises possibly can get those hips strong enough. You should try it again maybe a month after you start the exercises and see if you can. Because it's those hip muscles that get weak and aren't allowing you to stand on that 1 foot by itself. So how often do you do these balance exercises? We actually say pretty often. The intensity is the best of your ability for 10 steps at a time. Just 10 steps of each of those exercises. We'd like at least 3 times a week. You got to practice something to be good at it. If you don't practice, you won't change. Okay? So at least 3 times. I think it's nice if we kind of incorporate it into your routine so it's done every day. Because it's not a lot. It's some backward steps, some sideways stepping. Walk on your heels, walk on your toes. You know, each of us stand up and sit down from a chair about 40 times in a day. That's a lot of practice if we just start paying attention to what we're using. And if we're using our legs or our hands or someone pulling us up or how we're getting up. So just give it a try next time you try to get up. Now these chairs they are tough. You know, they are hard. There's nothing to, give you friction. They kind of slope down in the back to make you a little bit comfy, so they get you really locked in there. And they have no arms, right? But if you scoot to the edge and you give it a try, you might be able to do better than you think you could. Might be. So the 5 exercises really shouldn't take more than 5 minutes a day. If you like to do them longer, that's great. I think the biggest thing is just trying to make it simple enough that you do it routinely. Routinely needs to be for you to decide, but I think the more that you challenge your balance, the better your balance will be. And it doesn't have to be really scary situations to challenge it, but just making sure that you're actively thinking about it a little bit every day will do you a lot of good. The benefits to exercising and practicing our balance, preventing falls, that we've talked a lot about. Physical exercise has been proven over time and time again to decrease depression, help us think more clearly, just improve our overall health, specifically like our respiratory system, our muscular fitness. It also helps improve your sleep. The more active your days are, more oftentimes the better your sleep is at night. There's proven lower risk of early death, coronary artery disease, stroke, high blood pressure, cholesterol issues, diabetes issues. The list goes on and on. Look at that. It's not on this list without a proven study or two, probably more than that, to put it on this list, right? Reduces obesity, and weight loss is a positive, right? Often combined with a reduced food intake. But please make sure you're eating that protein. So many of us as we age start to stop eating the protein we used to. And don't forget that protein builds our muscles. Without that protein in our meal, we can't build the muscle no matter what exercise we do. All right. So the Center for Disease Control has great websites. So does the National Council on Aging. And then I also put the website there for the physical fitness guidelines for the older adults that I talked to you about today. Inside there are the exercises just as we've talked about, as well as other guidelines is regarding physical activity. As you get older, sometimes you need to think about different things. So it's always good to review information like that and come to conversations like this. I can't leave without one more time saying that 2 weeks from now over here in the Event Center, we are doing a balance screening. So it's a fall risk screening using a tool called the Steady, which has been put into the physician's toolbox as a way to identify their patients who have fall risk. So we'll be able to give you information to hand to your doctor, as well as information on classes if those are something that you would benefit from. The cost is free. It's to anyone in the community. All we require is an RSVP so we can be prepared for you when you come. Thank you so much for coming. And I can take any questions if you have any. Yes, sir.
What would you recommend for someone who suffered a stroke? They're on blood thinners, and the doctors are concerned about falling. They want them to use a walker. But the more they've used the walker, it seems like they're not working on their balance.
That's true. Let me just repeat the question. A gentleman here is asking if you've had a stroke. What possibly could you do for exercise if you're having to use a walker and the doctor is fearful of you getting away from it, but using a walker isn't really challenging your balance? Is that correct? So I agree that it's very worrisome for a doctor to be able to say, stop using that walker because we want you, obviously there's balance concerns already. And so doing some of these simple activities in the home where they can possibly still be hovering or holding on to it first, a countertop or a surface, maybe even their walker that they're comfortable with, is the right place to start. And if they're at that point where they're able to progress, then possibly because they've had a stroke, if they have significant weakness that they're concerned about, maybe adding a physical therapist to their group of providers would be a good thing. But I don't think that these exercises would be something that they couldn't do. If that one leg is really weak, they may have difficulty with some of the exercises, but I would definitely still give it to them to try. That sit-to-stand exercise, most people can't get around the way they want to if they can't get up from a chair. So that's where I'd start. Absolutely. Yes, sir.
What you discuss is good for preventing it. But what about at the time that you're about to fall? What is the proper way of falling? And if so, when you fall, what are the first aid that you need to do? See, preventing is good.
Yeah.
But what do you do when you are in the process of falling?
Well,
many years ago, I played judo when I was at a younger age. The first thing we learned is how to fall. Now that we have here, okay, it's inevitable that we're going to fall. How do you fall?
Well, thank you for asking that question. It's a great question, and I'll just repeat to everyone that's not here with us today. A gentleman is saying prevention is great, but what happens when you're falling? What do you do when you fall and after you've fallen? I think that's a great question. I think I've spent this whole hour just talking about how you fall and how you get up from the floor. So it's not something that's definitely easy. It sounds from your background that you've probably learned a good way to fall, of tucking your shoulder and rolling. But a lot of times we're not really able to think about that for sure. But we're falling. I can tell you one thing. If you reach out with that arm, that's probably going to be the arm that gets broken. They've shown us that for sure. There we go. So if we have that moment where we can think about it, possibly trying to tuck our shoulder and roll rather than putting the arm out, if possible, is a better approach. All right? I agree that preventing the falls can't save every one of us from a fall. We're just trying to do what we can to help as many people as we can not fall. But when... Oh.
Yeah, excuse me. Regarding the falling, I did have a stroke. And the first thing that, because of my stroke was in the cerebellum,
Oh, okay.
where you have balance,
Yeah.
so I do not have balance, only in my eyes, whatever it is, left. Otherwise, zero. And I tried walking backwards. That's what I did, backwards and sideways in the very beginning.
Yeah.
Exactly what you said. But when all that, I was still falling every 10 times a day. I was a champion in falling. And that's why the physical therapist taught me how to fall.
Yeah.
Because that's what my life was, falling. So you have to protect your head
Mm-hmm.
and become as soft as you can to roll with the fall. And like you say, no hands, so you don't break anything.
Right.
That's all. There was nothing else for me to do.
Thank you for that comment. You're right. Absolutely.
Can you do a demo?
I don't think so today. I'd be off camera. It wouldn't be fair. But if you do, please call 911. It's always the best to make sure that you're safe and that you don't have a broken bone, and that someone gets you the proper care that you need, if that's the case. Any other questions? Yes, ma'am. Just one moment, Elko.
Can balance affect your hearing?
That's a good question. She asked, can balance affect your hearing? Not necessarily. Bad balance doesn't cause bad hearing. Their hearing mechanism, the organ for hearing and the organ for balance, are right next to each other in your head. And they do share a nerve. But one being affected does not mean the other will necessarily be affected. There are some infections you can get in that nerve that can cause difficulty with balance and hearing right away. Yeah. There are people who have had tumors on that nerve who, what we actually start to notice is it's a slow growing tumor, and we realize it's there because they start losing their hearing and falling. We kind of get that correlation. But other than that, an infection or a tumor, something like large like that, they don't go necessarily hand in hand.
Thank you.
You're welcome. Elko, you have a question?
Yes, one of our participants here has a husband who likes to shuffle his feet, and he's always harping him to pick up his feet. What would you suggest?
Thank you. That's a good question. Shuffling the feet. That can be for a million reasons, right? Sometimes around here at this clinic, I'm seeing a lot with people who have Parkinson's disease. It's a part of the process that medications can help. Shuffling the feet also just comes from what we call deconditioning. That just doing less exercise than your body needs to maintain itself, and you just start losing strength, just doing your daily activities, and your feet start becoming too heavy to pick up. So sometimes it can just be by the fact that you need to get back to some aerobic exercise and strengthening to get your body a little bit more conditioned to be able to walk like you want to walk. and do the things in a more upright position, because we are all fighting gravity every time we're standing up. We're using our muscles to make sure that we can walk, and as well as many other parts of our body. But we have to put the exercise work in to make sure our bodies stay as strong as we can. Have them.
Is there anything a person with peripheral neuropathy can do to help their balance?
Good question. Thank you. She asked if there's anything that a person with peripheral neuropathy can do to help their balance. And just to kind of back up for a second, peripheral neuropathy often means that they have no sensation in their feet. So if you can't feel where your feet are, you're going to probably have a little bit of a difficulty standing up well or walking. Because I don't know if you've ever had your hand fall asleep or even had a glove on and tried to do something like zip up a zipper or button something with gloves on. It's a little bit harder when you don't have that feeling to give information to your brain about where you are in space. So, to answer the question about if you have peripheral neuropathy, meaning you have less sensation in your feet than normal, a couple things are very important. You have to have well-lit environments. You have to be wearing your glasses if necessary. You really have to make sure you're using the systems that can help you, meaning the eyes, because your ankles, that other part of your balance, aren't working so well. Also, you might be needing an assistive device like a cane around, especially in a busier situation, a place that might be dimly lit, have a lot of people, or more uneven surfaces. We like to make sure those legs are as strong as we can be. With peripheral neuropathy, again, it's back to the physical exercise. It's not been proven as an excuse not to exercise, and it's actually recommended that you exercise with peripheral neuropathy, and providing your body the best ability it can despite the lack of sensation.